This is Chapter 38, Lecture 2, Part 2. We're continuing the discussion on STIs or sexually transmitted infections. Lymphogranuloma venereum, or LGV, is caused by 3 strains of the Chlamydia trachomatis bacterium. It's less common than other types of STIs and difficult to diagnose because the symptoms are similar to other conditions. It may cause papules on the genitals, swollen lymph glands, rectal ulcers, pain, bleeding, and discharge. It can be mistaken for ulcerative STIs like syphilis and genital herpes, and if untreated, it may cause lymphatic obstruction and elephantitis, which is massive swelling of the scrotum. Limitations in commercially available tests. Diagnosis is mainly based on clinical findings. Treatment includes the use of doxycycline, erythromycin, or azithromycin. Pelvic inflammatory disease, or PID, is an inflammation of the vagina, cervix, uterus, and fallopian tubes in the female. It may be caused by a number of STIs if they are left untreated. Untreated scar tissue may develop in the fallopian tube, which then blocks movement of the ovum to the tubes. If the tubes are completely blocked, sperm cannot reach the ovum to cause fertilization. If partially blocked, a fertilized ovum may begin to grow in the fallopian tube rather than the uterus, which is an ectopic pregnancy. An ectopic pregnancy can rupture the tube, causing severe pain or even death. It's diagnosed by clinical symptoms and an ultrasound of the abdomen. Symptoms are similar to those of other abdominal conditions, therefore, thorough history and diagnostic tests are necessary, and it can result in blood clots, peritonitis, and even death if untreated. Antibiotics can cure PID, and treatment does not correct the damage already done to the reproductive organs. It's estimated by the CDC that more than 1 million women per year have an episode of PID. Prevention is the same as for other types of STIs. Syphilis is caused by the bacterium Treponema pallidum. Signs and symptoms are similar to other diseases, thus mimicking other conditions. About 36,000 cases of primary and secondary syphilis in 2006, and an almost 12% increase from the previous year. In 2006, 64% of cases reported were among men who have sex with men, according to the United States health officials, and it may be transmitted to a newborn by an infected mother, resulting in a stillbirth, developmental delays, or death after birth. It is spread by direct person-to-person contact with a syphilitic canker or sore. The sores may occur on the genitals, anus, rectum, mouth, and lips. The primary canker occurs in about 3 weeks or up to 3 months after exposure. It may heal without treatment, however, disease still progresses unless treated. Here's an example of a syphilitic canker. Signs and symptoms of the secondary stage: skin rash on palms of hands and the soles of feet and elsewhere on the body, along with fever, swollen glands, weight loss, and fatigue. Signs and symptoms of secondary stage may disappear without treatment. Latent stages occur 10 to 20 years after the first 2 stages have disappeared. An untreated person still has syphilis at this time. The disease will damage the brain, heart, liver, and other internal organs, cause paralysis, dementia, blindness, and death. It's diagnosed by a dark field microscopic examination of canker material or by blood tests for the presence of syphilis antibodies. In the primary stage, a single large dose of penicillin may cure a patient. Additional penicillin doses may be necessary for those who have had syphilis longer than a year. Having syphilis puts an individual at greater risk of contracting HIV sexually. Responsible sexual behavior and proper hygiene after sexual contact lessen the chances of contracting syphilis. Some cases of penicillin-resistant syphilis have been reported. Trichomoniasis is a protozoal infection caused by the organism Trichomonas vaginalis, resulting in an infection of the lower genitourinary tract. It causes a white or yellow foamy vaginal discharge with a foul odor in females. The male is usually asymptomatic except for urethral itching. The diagnosis can be made by obtaining a sample of vaginal secretions and preparing a slide with normal saline. Microscopic examination will reveal the Trichomonas parasite with 4 hair-like flagella whipping across the field. Treatment for both males and females is a course of the antibiotic metronidazole or tinidazole taken orally. Changing gears, let's start talking about the urinary system and the medical issues associated with it. The functions of the urinary system are to filter and remove metabolic waste products from the blood, help maintain electrolyte and pH balance, excrete waste from the body in the form of urine, and help regulate red blood cell production and blood pressure. Urinary tract disorders, an increased urine production seen in diabetes, and frequency of urination seen in urinary tract infection. Severe pain in episodes of kidney stone movement, swelling and weight gain in congestive heart failure and renal dysfunction, decreased urinary output seen in urinary obstructions, maximum volume of urine the bladder can hold declines with aging, leading to increased frequency of urination and, in some individuals, incontinence. Most people urinate 4 to 6 times per day and excrete about 2,000 cc's or 2 quarts of urine per day. Urine specimens are easily obtainable. It's a non-invasive way to evaluate the homeostatic condition of the body. Among the most frequently ordered tests in the medical office, collecting, processing, and testing urine specimens are duties of the medical assistant. After the patient is greeted and escorted to the examination room, the urine sample may be requested. Provide the patient with clear directions on the type of sample required and give an appropriately labeled container. Something to add to this is that it might be good for the patient to go ahead and go to the exam room first to leave any coat or items that need to be set down in the exam room, and then you can go ahead and escort them to the restroom. And we've already gone over how to give directions to obtain a clean catch UA, so you should be good at doing that. Wear gloves when handling the patient samples, as urine samples are potentially infectious. After the sample is obtained, it is tested or stored for processing. Be sure to follow processing guidelines to maintain integrity of the specimen and ensure valid results. Know Table 38-3 and the items in it. Prostate conditions. BPH, or benign prostatic hyperplasia. This is an enlargement of the prostate gland that may occur after age 50. As the prostate enlarges, it presses on the urethra and causes restriction of the flow of urine. The restricted urinary flow can result in urinary retention, interruption of the urine stream, and difficulty starting to urinate. This is a drawing of the urinary bladder, and here is the urethra. This is the prostate, and when this becomes enlarged, it presses in and causes a restriction of the flow of urine from the bladder to the outside of the body. Benign prostatic hyperplasia medications are available that may relieve the symptoms in some men. Non-surgical treatments may also be successful. Prostate cancer may spread to adjacent urinary tract and male reproductive organs, as well as to lymph nodes and bones. It is the second most common form of cancer in men, with 1 in 8 males affected. Because of its slow rate of growth, prostate cancer can be detected and treated in its early stages with regular medical examinations. The cause is not known, but age, heredity, and a high-fat diet increase the risk of developing it. Symptoms of prostate cancer are weak stream of urine, blood in urine, erectile dysfunction, nocturia, which is frequency of urination at night, and pelvic pain. Screening for prostate cancer is protein-specific antigen, or a PSA blood test, and digital rectal examination used to screen for prostate cancer. The PSA checks for a protein released by the prostate. A biopsy of the prostate tissue is done if levels are elevated, and it's usually in the office. If the results are positive for cancer cells, a bone scan is done to detect possible spread of the disease. Treatments for prostate cancer are watching and waiting with regular checkups, surgery, radiation, hormone therapy, or chemotherapy. The PSA results. Under 4 milligrams per deciliter are considered normal. Interpretation of results and additional testing are needed. A very high result may not mean prostate cancer, and a very low result may not mean individual is cancer-free. Renal failure, the inability of the kidneys to adequately filter metabolic waste products from the blood. Many causes lead to the decline of renal function, and renal failure is classified as acute or chronic, the rapid onset of a few days to a few weeks. Acute renal failure is caused by any condition that decreases blood supply to the kidney, obstructs the urine flow of urine anywhere in the urinary tract, or injures the kidney. Symptoms include fluid retention in the hands and feet, dark-colored urine, decrease in urinary output, and nausea. Symptoms of renal failure are fatigue due to increase in metabolic waste levels in the bloodstream, and pruritus, which is just itchiness. A diagnosis of renal failure, you have to get a BUN or a blood urea nitrogen, the creatinine, electrolytes, and diagnostic tests, a CAT scan or an ultrasound. Acute renal failure can affect people of any age, more common in older people, and dialysis and transplants have greatly improved the survival rate. Chronic renal failure is a slow progressive decline in kidney function over a period of months to several years. Acute renal failure can become chronic if, after treatment, the kidneys do not fully recover. Any condition that can cause acute renal failure can cause chronic renal failure. Some common causes of chronic renal failure: diabetes mellitus, hypertension. Other causes of chronic renal failure: kidney abnormalities, kidney disease such as glomerulonephritis, and autoimmune disorders such as systemic lupus erythematosus. In chronic renal failure, patients may experience mild symptoms, including nocturia and elevated blood urea nitrogen. As the condition progresses, fatigue, lack of mental alertness, anemia, loss of appetite, and shortness of breath affect the patient's quality of life. The diagnosis is based on patient history, symptoms, blood tests for levels of creatinine, and blood urea nitrogen. It is fatal if not treated. Survival for patients with end-stage renal disease is only a few months. The treatments include restriction of protein and calcium in the diet, various medications to adjust the blood pressure, regulate electrolyte imbalance, and counteract anemia. Kidney dialysis or transplant are alternatives when treatment is not effective. Most patients with advanced renal failure die within 5 to 10 years, even with the benefits of improved dialysis. Bladder control. Lack of bladder control can be embarrassing for a patient. It is sometimes caused by poor muscle control, trauma, improper placement of organs. Urogynecologists, urologists, and geriatricians may be able to help patients with medications, exercises, and surgeries.